Welcome back to Toledo Clinic TV, and our discussion for this segment is focusing on heel pain with Dr. Maggi Smith, a podiatrist. When we talk about heel pain, it's a pretty common condition that you see in your practice.
It absolutely is the most common condition that walks into my office.
And the condition is called plantar fasciitis.
Correct. So it's either known as plantar fasciitis or heel spur syndrome. So it is not uncommon for a patient to walk in and say, I have a heel spur. You have to go cut it out. And that's not the case at all. So they may come to me because their family physician referred them with a complaint of heel pain. They may come in with pain in the morning, and after periods of rest, they go to get up and it causes them pain. And it's been progressively worsening. Typically over 3 or 4 weeks, it gets worse. So most of the time they wait and see if it will resolve on its own. And when it doesn't, then they come in. But before they come in, maybe their family physician orders an x-ray, and on the x-ray they see a heel spur. But it's not the spur that ever causes the pain. So they don't typically need to have surgery. Only 5% of the population will ever need to go to surgery with that complaint. So what it is the ligament called the plantar fascia. It is a ligament that has no function whatsoever, and it pulls and tugs on the heel bone, creating pain and inflammation. It gets better with stretching exercises, anti-inflammatory medications, inserts that fit inside your shoes, and those are called orthotics. You can absolutely start with something over the counter. You can get it at any of your running stores. You can go to your local drugstore to get a pair of inserts. One other thing that's really important is no barefoot walking. Typically, the reason why patients develop heel pain is because they flatten out their arch when they go to stand up. So if we can support the arch with something, whether it's a good shoe that has a good orthotic footbed. I have some favorites, including Birkenstock sandals, which I think are amazing. That would be something that somebody could wear around the house, but they can also wear it outside. Or these orthotics in their regular tennis shoes.
So it's not something that's really caused by doing something, an injury necessarily.
So not necessarily. We do have some patients that will come in with some sort of trauma, like they jumped off of something and they created that inflammation, but that's very rare. So when I had it when I was a resident, I didn't have any injury. I was just walking, and it happens to anybody at any time for any reason. It doesn't matter how old you are. It doesn't matter how active you are. Anybody at any time can have this condition.
Is there anything that you can do to prevent it?
Absolutely. If you can stretch every day, it would be great. So I still stretch every single day, and all I do is to step on the bottom of the last step. Of course, don't do it at the top of the steps, try the bottom. And I put the ball of my foot at that step, and then I stretch my entire leg every single day. If you don't want to do that, or if you live in a home that doesn't have any steps, you can take a belt or you can take a towel and extend your toes towards your nose by keeping your knee straight. And that takes 2 minutes to do, and that pretty much helps. Those are good prevention. Always wear good supportive shoes with a good arch. Try to stay away from high heels, because the minute you wear a high heel as a woman, you contract the plantar fascia as well as the Achilles tendon. And then when you go to wear a regular flat shoe, you develop that pain. So if you're going to wear a shoe with a little bit of a platform, you just must compensate with some stretching.
Okay, and not maybe wear them for quite as long of a day as you would.
Correct.
Yeah, okay,
Yeah.
all right.
That's right.
Very good. Thank you, Dr. Smith.
Thank you so much.
We'll be right back.